Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in ophthalmology. Discover a new show at itube.net/podcasts.
Hi, thanks for joining me for this episode of the Mod Pod. Welcome to those of you tuning in for the first time. I hope you like what you're about to hear, and for those of you who are returning listeners, thanks for coming back. I hope you enjoy a nice southern accent, because in this episode, we unintentionally featured two articles by optometrists who practice in North Carolina. Let's have Rachael Wruble, co-owner of Belmont Eye and Northlake Eye, start us off. Online sellers often try to bypass requirements for prescription verification, but efforts are being made to prevent such activities. Listen as Dr. Wruble describes some of the harmful loopholes that exist in contact lens legislation.
Approximately 45 million Americans wear contact lenses, with the average wearer being 31 years of age. Contact lenses are safe and effective medical devices when prescribed by a licensed optometrist or ophthalmologist. However, they also present potential risks, including serious eye infections and corneal ulcers, and the risk of infection increases with improper care and use. The FDA regulates contact lenses as Class 2 and 3 medical devices and requires consumers to have a valid prescription from an eye care professional to purchase them. The length of time a contact lens prescription is valid varies among states, but 1 year is most common. Both the FDA and the Centers for Disease Control and Prevention advise consumers that contact lenses are not one size fits all, and that regular comprehensive eye examinations are necessary to ensure optimal eye health with the use of these devices. Even with eye care professionals performing contact lens fittings, evaluations, and education, we see a growing trend of patients purchasing their contacts online. According to one survey, 61.7% of respondents who purchased contact lenses online cited cost as the driving factor, and 55.2% said it was simply easier to purchase their contacts online. Another 20.5% reported liking that contact lenses purchased online arrived sooner than those purchased from an eye care provider. Many online contact lens sellers not only permit consumers to purchase these medical devices using expired prescriptions, but they're also allowing them to switch to different brands or types of lenses that were not prescribed by their eye doctor. Although these kinds of practices are outlawed by the Federal Trade Commission, specifically in the Fairness to Contact Lens Consumers Act in the contact lens rule, online sellers commonly exploit loopholes in the current verification process to bypass enforcement of these regulations. One such loophole often employed by online contact lens sellers involves automated robocalls. Automated robocalls are usually made after hours to an eye care office and leave low-quality recordings. They neglect to include the necessary information to confirm a prescription, which creates barriers for eye care professionals to respond with any corrections. In some cases, optometrists are unable to immediately provide critical health and safety feedback, especially when requests are made regarding an incorrect device or an individual who is not a patient of the doctor. Some online sellers also use automated robocalls to take advantage of the current passive verification provision of the FCLCA and the contact lens rule, which states that eye doctors have only an 8-hour window to respond before a prescription is automatically verified. By exploiting this provision, online sellers can push contact lens products not prescribed by an eye doctor. A report from the American Optometric Association Health Policy Institute in June of 2020 found that among optometrists who provide contact lens services, 89% received prescription verification calls for invalid prescriptions. 54% received prescription verification calls for an altogether wrong prescription. 43% received prescription verification calls for someone who wasn't their patient. There is legislation under consideration to counteract exploitation of the FTC regulations. U.S. Senators John Boozman of Arkansas and Tammy Duckworth of Illinois announced the introduction of bipartisan legislation to make purchasing contact lenses online safer and more secure. This legislation is supported by the Healthcare Alliance for Patient Safety, the American Optometric Association, and the American Academy of Optometry. As of March 1st, 2022, the bill had 58 co-sponsors in the House and 3 in the Senate. The bill, titled the Contact Lens Verification Modernization Act, which is House 3353 and Senate 1784 bill, would prohibit the use of automated robocalls as a method of verifying a prescription. It would also require online contact lens sellers to allow patients to electronically upload contact lens prescriptions and mandate encryption when emailing medical information protected under the Health Insurance Portability and Accountability Act. Online sellers are being held accountable for reckless business practices. On January 28, 2022, the FTC reached a $3.5 million settlement with Hubble Contacts. The FTC complaint against Hubble, filed in the U.S. District Court for the District of Columbia, combined allegations of violating aspects of the contact lens rule and engaging in misleading marketing activities related to consumer reviews. Specifically, the federal complaint alleges that Hubble sold contact lenses online without verifying customer prescriptions, substituted its own brand of lenses for brands originally prescribed by the customer's eye doctors, and falsely represented that it obtained independent consumer reviews of its products and services, when in fact the company compensated for favorable reviews and included reviews written by individuals with direct connections to the company. In 2017, Hubble was found to have contacted certain patients, offering them a free 1-month supply of contact lenses in exchange for a positive review. One of the reviews was written by Hubble's own Director of Customer Service. This case is the largest fine in history of contact lens rule violations. In addition to the $3.5 million fine, Hubble must now directly communicate to its customers that you may have received Hubble contact lenses that were not fit on your eyes or prescribed. The FTC says that Hubble may not have properly verified your prescription with your doctor before sending your contact lenses. Despite the exploitative activities by online contact lens sellers, it is encouraging to see action taken against FTC violations. We as optometrists have the power to influence legislation that would further protect our patients. Because contact lenses are medical devices that can lead to significant risks with improper care and use, we must fight to ensure that our patients are getting the best possible chance at maintaining healthy vision when they purchase from online sellers.
To find out what you can do to support the Contact Lens Verification Modernization Act, go to modernod.com and check out the online version of Dr. Wruble's article. We're going to take a short break right now. We'll be back after this.
Support for this podcast comes from Bryn Mawr Communications. BMC produces a number of informative podcast series spanning a variety of topics in ophthalmology. Discover a new show at itube.net/podcasts.
The next and last article of this episode is just as informative as the first, only on a more clinical level. How adept are you at distinguishing between neurotrophic keratitis and neuropathic pain? Here's Tim Poirier, an optometrist at the Eye Institute in Raleigh, on how to tell the two apart based on their causes, symptoms, and treatment.
Neurotrophic keratitis, NK, and neuropathic pain may sound similar and can have mutual comorbidities, but they are vastly different when it comes to their causes, symptoms, and treatments. Understanding the differences between these two corneal anomalies and knowing how to manage them can go a long way in providing the care your patients deserve. In this article, I offer a brief distinction between the two. With NK, keep in mind the adage, stain without pain, while evaluating the cornea behind the slit lamp. Clinical examination will reveal significant superficial punctate keratopathy, which can progress to a persistent epithelial defect and ultimately result in a sterile corneal ulcer, stromal thinning, scarring, and/or permanent vision loss. NK is classified into 3 stages based on its severity. Numerous etiologies can cause damage to the ophthalmic branch of the trigeminal nerve, which leads to NK. If the corneal nerves were working properly, NK would produce a significant pain similar to that of patients presenting with a corneal abrasion. Symptoms from NK include light sensitivity, difficulty sustaining vision for a prolonged duration, along with decreased vision, stinging, burning, and foreign body sensation. The absence of pain is an important distinction between NK and neuropathic pain, which will be discussed later. Other comorbidities such as meibomian gland disease, ocular surface disease, poor nocturnal lid seal, contact lens overwear, and toxicity to solutions are often associated with NK, making the diagnosis challenging without a confirmatory test. Corneal sensitivity can be assessed qualitatively with a handheld device, which some tertiary care centers may have. Primary care clinics generally have qualitative tests at their disposal. Alternatively, a practitioner can use dental floss, the teased out tip of a cotton swab, or the tip of a tissue rolled into a point to test corneal sensitivity. These inexpensive and readily available options will show normal, decreased, or absent corneal sensitivity, confirming NK as the correct diagnosis when corneal sensitivity is decreased or absent. When the tip of tissue is placed on a normally innervated cornea, the patient will have an immediate blink response. Historically, NK has been difficult to treat, with main efforts to improve corneal integrity. Topical steroids, autologous serum drops, and amniotic membranes or amniotic drops can help improve the surface of the cornea. The use of Synedrimin BKBJ ophthalmic solution 0.002%, a topical nerve growth factor medication approved in 2018, allows the nerves to heal as long as other comorbidities are treated correctly. Homeostasis can be restored by getting to the root cause of the disease, which is poor nerve innervation. Our nociceptors can undergo a plasticity process called peripheral sensitization, which occurs when nerve injury and inflammatory mediators result in pathologic structural changes of the corneal nerves. The process lowers the normal pain threshold and causes ectopic discharge of the nociceptors even with non-noxious stimuli, making the diagnosis of neuropathic pain similar to that of ocular migraine, in which it can feel like a diagnosis of exclusion. Neuropathic pain, or pain without stain, occurs when a patient's symptoms are disproportionate to the clinical signs. There may be mild ocular surface disease, possibly more thickened turbid meibum, and minimal superficial punctate keratopathy, but the patient seems to be experiencing significant pain, which doesn't correspond to their clinical picture. Corneal sensitivity testing will produce an increase in discomfort and an excess reaction when the cotton wisp touches the cornea. Etiologies of neuropathic pain include ocular surface disease, toxicity from preservatives, trigeminal neuralgia, infections, like herpes keratitis and radiation keratopathy. Neuropathic pain can also be caused by cataract and refractive surgeries as well. Systemic etiologies include diabetes, fibromyalgia, and Sjogren's syndrome, with anxiety and depression being potentiating comorbidities. Performing a proparacaine test, which practitioners can do in office, allows us to decide on treatment options. If the pain is peripheral, then topical medication would be the option. If the pain is central, then treatment would take more of an oral path. If the pain is both peripheral and central, then topical and oral medications can be used. After installation of 1 drop of 0.5% proparacaine, the practitioner asks if the pain has resolved, which would indicate a peripheral source. If the pain remains the same, that would indicate a central source, or lessened in severity indicates a combined peripheral and central source. Managing neuropathic pain can be challenging and involve a multidisciplinary approach. For peripheral disease, controlling lid wiper epitheliopathy by making sure the meibomian glands are functioning well, checking for poor lid seal at night, and managing inflammation, which can reduce the neuroplasticity of the corneal nerves. Autologous serum contains nerve growth factors, an anti-inflammation substance, and can prevent apoptosis in the cornea and conjunctival epithelium. Omega-3 fatty acids and cyclosporin, along with amniotic drops and/or an amniotic membrane, can also be helpful. For patients with centralized neuropathy, gamma-aminobutyric acid inhibitors, tricyclic antidepressants, and anti-epileptic medication can be prescribed. Acupuncture may also have a place as an alternative therapy. A multidisciplinary approach with the collaboration of eye providers, a pain specialist, and cognitive behavioral therapist often is needed to improve patients' overall well-being. Understanding the difference between neuropathic pain and NK can help mitigate a potentially dangerous and difficult to treat disease entity and can allow early treatment, which increases the success of restoring homeostasis and ultimately provide a better quality of life for our patients.
If you're a more visual person like myself, then head to our website at modernod.com to view the Mackey classification of the 3 stages of NK, or to get a breakdown of some possible ocular, systemic, genetic, and central nervous system causes of damage to the ophthalmic branch of the trigeminal nerve, which leads to NK. I hope you enjoyed this episode of the Mod Pod. I also hope you were able to take away a helpful piece of information that will benefit your practice. Well, that's a wrap. Modern Optometry will be heading to Nashville in a few weeks for the inaugural Mod Live meeting, May 5th through the 7th. It's not too late to register, so if you're interested, go to modlivemeeting.com. I hope to see you there. Thanks for listening. Until next time, be well.